Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Hi everyone.
Hello.
First of all, thank you. I also have a neck-related question. So I've been getting symptoms for the last 3.5 months. Primarily now is just headaches in different spots, and fatigue. Fatigue's on and off. But I did your course, which was really helpful, and I found a practitioner. The first session, she went in, dug into my neck muscles, and that caused a lot of relief. In fact, that helped me reduce sensitivity to my activities, which previously flared up. So I could sit on computers, I could go be in a subway, grocery store. It didn't affect me. Even though headaches were there, but it did drop the sensitivity by a lot, and drop the headaches as well by a lot. And then the problem is, I realized in the next session, whenever I tilt my head backwards on the left side, there's a sharp pain. So my practitioner said that there's a joint restriction. And in the next session, she did an adjustment and acupuncture. However, the neck restriction pain only went away for like half an hour, and then it came back, but at a lesser degree. And also, after the session, when I tried to lay down for a nap, I felt like I was falling, which was weird. Even she found it weird. And then I met her after that once, where she did some mobility exercises and some more manual therapy. It caused relief for the first some time, and then the pain was back again, and the headache is also back again. Since I started this, I'm so much better. I can do a lot of things, but the pain's still there. And the joint restriction comes back rather quickly. Any suggestions?
Yeah, I mean that's common. It's you can't just get rid of these things generally in 3 sessions, but the fact that you had such tremendous relief with it the first go around, it tells me that we're on to the right thing. You probably just need a little bit more, right? Like what I explain to my patients is that, when I treat you, you might feel like absolute garbage after the session, or you might have a lot of relief. Either way, that's a good sign because it tells us that your neck is definitely involved in the symptoms. Now, what I generally start to get a sense of when I'm treating somebody is, okay, when I treat you, if the symptoms go away or get better, how long or how many days or how much time passes before they come back? And then if they're coming back after, let's say, 3 days, you're back to kind of where you were at square one. Usually what I'll do then is I'll just increase the frequency of my appointments, because if I see you and now you're here, and then when I see you again, you're back down to square one, and then I treat you again and you're up here and then you're back down to square one, well, I'm not really building anything. So what I want to do is I want to treat you here, and then when you get up here and you're starting to kind of come down again, I want to treat you again so I can build on that, right? So it may just mean that you need just to increase the frequency a little bit. I usually start with people once a week, and then the same is true. If I see you next week and you're like, I still feel pretty good, then I start pushing you out. Okay, let's try every 2 weeks. Oh, I'm still good after 2 weeks. Okay, let's try every 3 weeks. And then eventually I just say, okay, call me when you need me, right? If you have neck dysfunction, it's generally going to come back. It's not something that's gone forever. You're always going to have some issues that flare up every once in a while. Like I'll have patients that I've seen 6 months ago and they've been fine. And then they're like, my headaches are starting to come back. Okay, that's fine. Do a little bit more treatment, give them a few more exercises, and away they go. So you may just need to increase the frequency a little bit. It may just be, you just need, a few more weeks of this before it starts to go away. Yeah, I think you're just on the right track. So don't be in too much of a rush, but it sounds like you're on the right trajectory.
No, thank you. For the sessions, what should we focus on? So, um, the manual therapy, or like the last session, it was just the adjustment as well as acupuncture, but not much on the neck. My practitioner focuses acupuncture only on the head. Um, so, so in these sessions, should I be asking her to be focusing on the adjustment for the joint mobility as well as the manual therapy, or what should we focus on?
Well, that's really up to your practitioner to decide because I haven't assessed you. I can't tell you what you should focus on because I don't know what the issue is. Um, but if you go and watch those 2 manual therapy sessions, so if you go to resources and click on my
I've,
section,
I've done that, yeah.
yeah, so watch those 2 manual therapy and that'll kind of show you kind of what you're after. Generally the first 6 sessions are mostly manual therapy until things are kind of moving well. Then we start in with, okay, let's start doing proprioceptive exercises, which are kind of those mobility ones that you're talking about, where we're looking at head movement, pairing it with eye movement, those types of things. And then we get into kind of stability and strengthening to kind of keep things held where they're at.
Gotcha. So while I'm doing this, I know in the videos you mentioned not to avoid strengthening exercises, but my practitioner has given me chin tucks and all of those things. Is that okay to do
Yeah,
while I'm?
they might feel that you're at a place where things are moving decently well and you're ready to start that. Right? So everyone's a little bit different. Some people I have to stick with just manual therapy for a long time because they have a lot of, dysfunction. I just need to work that out first. Other people, it's like you see them, they got a pretty decent neck, they just have a few issues. I'll give them strengthening stuff right away. So it just depends on where you're at. So
Okay. And sorry, last question. It is there. I mean, according to you, is it normal that after an adjustment I felt like I was falling down while I was lying down? It happened only for a second, but is that something that you've seen with other people?
Yeah, anytime you do like any manual therapy, adjustments, whatever, it's like you have to kind of recalibrate your kind of your new neck, right? It changes the input from the sensors. Your brain's trying to figure out like, okay, where am I now in space? And sometimes you'll have kind of weird symptoms, like you'll have a little bit of increased dizziness afterwards, or muscles will tighten up or they'll loosen or whatever. So it just depends on the response to it. That's fairly normal.
Gotcha. Well, thank you.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.